Hey everyone, how are you doing? Glad that you're here with us. My name is Dr. Erickson, EHS Physical Therapy, chiropractic.
Yeah, and I'm Dr. Jake Anderson with Essential Motion Spine and Sport.
So we partner together for very specific reasons. We enjoy, not enjoy, we truly love and are very passionate about helping people with spine conditions, especially disc conditions. So, back, neck, leg pain, arm pain. Now today we want to talk about one of the most common low back issues that affects a lot of you out there, which is called sciatica. So sciatica is it's kind of a garbage pail term for any pain in the leg.
Yeah.
Now, typically it's more in the back of the leg. Glute, hip, kind of goes down. It can go below the knee into the foot. But there could also be leg pain that comes to the front of the thigh, to the side. For the point of this purpose, we're going to talk about the classic sciatica, right down the back of the leg, all the way to the heel or the foot. We want to talk about the top, really, 3 causes. These things are going to encompass almost all causes of why you're having the sciatica. Now, there are some rare things that maybe, but I mean, this is going to be 98, 99% of all sciaticas are going to be caused by one of these 3 things.
Yep.
What's the first one?
Number one by far, we talk about this all the time, is going to be a disc injury or a disc herniation. So Jackson, if you come in here, we'll kind of show what that looks like. Here's the bones of your spine, right? Then you have the disc in the middle here. The outer layer is like a thick band of tissue, and the inner layer is like a jelly-like material you can kind of think of. And then here we got the nerve root. So when we get that herniation, that piece of soft tissue gets in that joint space, and it can either mechanically, like actually compress that nerve root, or it can just be the inflammation and the chemicals that stirs up can irritate that, from the injury, that irritate that nerve root, and that's what causes that sensation where you get the like burning, that tingling, that sensation down the leg, sometimes in the butt, back of the leg, even into the calf. So disc herniation, by far, like I would argue that almost 98% of.
Well, it's really, so the sciatic nerve is a real nerve, but it forms kind of in the buttock, and then it's to the back of the knee, and then from the back of the knee it splits into 2 different nerves from there. But normally it's not the full the big thick sciatic nerve that's injured or being pushed against.
Yeah.
It's one of the roots, like a rope. All of the strands from 3, 4, 5, S1, they all come together to form the nerve. So any one of those strands that's irritated affects the whole nerve.
And that also determines where you feel the symptoms.
Yep.
But yeah, by far number 1, disc herniation. What do we got for number 2?
So number 2, so the soft tissue is going to be the number 1 and number 2 causes. And in this case, it's not the active, what we would call derangement, right? So the first one is a disc derangement where it's actively there, it's moving, it's changing, it's dynamic. You feel better and worse based on position, time of day, movement, sitting versus standing versus walking versus bending. The other one could be if you had one from the past, and we're talking 8 weeks plus, so 2 months, 3 months, 4 months, 5 months later, I had that at the time, I treated it conservatively, it went away, I feel better, but now all of a sudden I still have this pain in my leg only when I bend forward. So when I bend, whoop, there it is. And then when I stop, nope, I'm good. And I can probably sit and do other things, but it's just very specific and it's very consistent, where every time I bend forward to pick something up, I get this pain in the back of my leg. So that's more from when that thing healed, there was some scar tissue that formed around the nerve, and you have a bit of an adhered nerve root, so it's more of what we call a dysfunction. It's tightness along that nerve path, and so when the nerve tries to slide through its container and move and lengthen and stretch, it's getting obstructed or stopped by some scar tissue. So it's another soft tissue problem. We would treat that differently than a disc injury, way differently. I mean, exact opposite. That one you actually want to work into and continue to kind of tug on it and irritate it and get it to remodel.
Yeah.
A disc we want to actually reduce and go the opposite direction and move it out of the way and allow it to scar down. That's the top 2, probably high 90%.
Yeah.
The third one Jake's going to go over is more bony related, more like the actual bones around here, which is different than the soft tissue.
Yep. So with aging, you've all heard osteoarthritis, degenerative joint disease, all these types of explanations for what can be going on. But essentially over time, just with birthdays, I mean, this space where the disc is naturally going to sink down, and it's going to get smaller as that disc thins out. And you can see that joint space here starts to minimize. It gets smaller and smaller and smaller and smaller and smaller until that narrow opening doesn't give that nerve root enough room to move, slide, and that's what causes some like more bony compression going on through there. We can also have, and this isn't like super common.
So that one's called stenosis.
Yeah, that's called stenosis right there, or narrowing of that space. But then we can also get where the vertebrae start to shift, and we call this a spondylolisthesis, which is just a fancy term meaning one vertebrae is moving forward where it shouldn't be, and that can create some of that compression too. When that bone slides forward, it can irritate that nerve root. So those are the bony causes.
Pretty good here.
You might be able to represent it better on that one.
Bone, as that one slides forward, you can see where that piece of bone
Perfect. That's it better.
kind
Yeah,
of
that's
pinches against the rim or the edge of the other one. So as it slides forward, which it's not supposed to do, but sometimes it happens, it compresses that root down there. And then you'd feel that more in standing and walking would be worse, and you'd actually feel better when you were bending because it opened it up, it give you more space. So
Chris,
different presentation.
Yeah, Chris made a good point there. Just because you have bony changes doesn't mean that we can't change it here in the office with chiropractic physical therapy. We can usually still create some symptomatic relief. Now, in more severe cases with like a spondylolisthesis and some stenosis going on, eventually that might need to progress to more of like a surgical care. But rarely do you need to do that. You can usually handle it in the office with some specific movements and exercises. Yeah. So, yeah, those are the top 3 causes. So again, soft tissue disc injury is the most common. Mm-hmm. Then you have like a resolved disc injury where you have an adhered nerve root. More so those are the soft tissue causes. And then we get into more like bony changes like stenosis or slippage or moving of the vertebrae. So a lot of people deal with this, and it really causes a lot of suffering. And a ton of people they don't like that leg pain, and they can even have the back pain with it. So people want to know what to do.
Yeah.
What,
so that's
should
the
they
thing.
do?
You need to know what movement to do, right? What direction?
Yeah.
First of all, you need to know what the cause is.
Yeah.
So once you know what the cause is, the origin, then we can show you. Okay, you need to do these movements, right? So we need to either do disc-related movements, or maybe we need to do resolved or dysfunction, right? Scar tissue movements, or maybe we need to do bony changes movements. And so the biggest the thing that we can help the most right now is
come on over here.
Jake and I have a course out that's normally $30, and right now it's discounted to $13.99, and it is how to quickly fix this sciatica problem in 5 easy steps.
Yeah, I think it's a pretty quick little course. It's under 2 hours, I believe.
Yep.
Yeah. So yeah, that's a low level entry for you guys to get in there, get some valuable information, and you will probably find some relief with the information that we talk about in there. So if you're dealing with sciatica, check that out. Just Google how to quickly fix sciatica in 5 easy steps, and you'll find that on the website Udemy.
Udemy. Yep.
Udemy.
Yep. UDEMY. It's a course, a site for different courses.
Yeah. Perfect. Comment below.
Thanks a lot.